All right, good evening, everyone. Another day for geriatric nursing or gerontology. Today, we are going to discuss changes associated with aging. And so, we will discuss almost all the systems and then what affects the older adults. If time permits, then we hit onto the psychosocial aspects, even though that one we generally talked about it when we were doing the assessing the needs of older adults. So when it gets there, it wouldn't be much of a problem. So we'll still go with what we always do, discussion, lectures, and then if there are any contributions, you bring it on board. All right. So the longer I live, the more beautiful life becomes. Count your age by friends and not years. And then count your life by smiles and not tears. So general physiologic changes, these ones we may meet them even when we are talking about the systems. So generally, the older adults would have gray and thinning hair, wrinkled and pigmented skin, eyes slightly sunken, and yes, what we have on the screen. Generally, we should know that aging is a natural process, and so everyone must undergo this phase. We listening and then we even talking about it now. We have to undergo this phase. And then, of course, at our own pace and at our own time. So, in the broader sense, it reflects all the changes taking place over the course of life, everything. So, it starts, of course, from birth as we grow, right? As one grows up and then develops and attains its maturity till the final stage. So, to we, the young ones, aging is exciting, right? When we are growing, it's exciting. Of late, I think there's a song where they say adulthood has come. So we would realize that whilst we were growing, we were so happy about the things that we were encountering. But we get to a point where there's responsibilities and all that affect this aging, and then we become quite, we think that if we were younger, maybe our parents would have cared for us. So the same way to those who are old, like the older adults, the aged, from the young old to the frail, they would also think that, oh, I wish I was younger. So it's like that. Middle age, yes, the time when people notice the age-related changes like this graying of hair and then thinning wrinkled skin and decline in physical activities. Even the healthiest person, those who go for the BBLs and then the aesthetic treatments, they can never escape changes, right? Changes in the older adults. They will grow and then hit it. Yes, people go through exercising and other things, and then it's one way or the other help them achieve that aging system very well. But then still there are changes in the bodies where we will never run away from. So these are just the general ones that we've seen here. Okay, so now we'll be talking about each the systems and then yes, sensory changes. We have the ear, nose, touch, smell, eyes. So we'll talk about them. So now the ear. We would have presbycusis, hearing loss associated with normal aging. It's just normal. It happens. So they tend to have atrophy of the inner ear structures that causes this um, hearing loss. They also have degenerative changes that occurs in the ossicles. So that also contributes to hearing loss. That's the presbycusis. Most of the older adults are approximately about between 30 and 50%, with the research saying that they experience hearing loss or presbycusis. And it increases with age and is greater also in men than in women. We have also tinnitus or tinnitus, however you say it. I always say that these scientific terms are not my language. So, however you mention it, tinnitus, of course, ringing in the ears, and also occurs with hearing loss. Yes, occurs with hearing loss, and then, of course, associated with aging. We have tympanosclerosis over here as well. where there's calcification of the tissues in the eardrum, the middle ear, and then including the tympanic membrane. We also have impacted cerumen. So there'll be calcified and harder cerumen, and then the cerumen gland, they get reduced in number and then causing dry and then hard earwax. It causes also itching as well when they have this impacted cerumen. It causes itching and then a dry ear canal as well as pruritus. And then difficulty in speech discrimination. Yes, if they have even this impacted cerumen, like this hardened thing there, when it's calcified, definitely they would have issues with speech discrimination, degeneration of cochlea, and then the auditory pathways. Then we have nursing implications or nursing interventions. What do we do? What do we do? Maybe when we discuss, then when we get to this point, we would come in because these ones are something that we should be able to know when we experience an older adult having generally presbycusis, because it is that will aid in the other conditions as well. So what do we have to do? How do we assess? What do we have to do for them, intervention for them? So assess clients' ability to communicate, check if their clients can hear alarms and doorbells, emphasize safe driving and taking public transport. So in any case, if they want to drive, then fine. Then we have to do that, emphasize if it's going to be safe. Okay. Then encourage a client to engage in leisure and then recreational activities. Of course, it always goes down with assessment. They have to be going to the clinics or hospitals all the time for every part of the system assessment. So yeah, with the ear, yes, they would have to go for ear assessment. If there's anything you want to add on, we can chat right in the chat box, and then we move on. I think when we get to the system, then I'll let you come in to talk and then contribute. But if there's anything else we would have, especially with the assessments, the interventions, we can add it on here. You can as well go find out more of the condition that affects the older adults in terms of the hearing. But the common ones are what we have mentioned. All right. The eye. The eye. So we have thinning of the skin surrounding the eye. We have presbyopia. So change in the length of the eye involving loss of accommodation. Presbyopia, loss of lens elasticity. So mostly objects held closer than one, closer sometimes becomes a problem. So loss of lens elasticity, as well as even with the visual acuity as well. They have decrease in visual acuity, and so that also probably have problems with seeing things closer to them. Now, atrophy of the lacrimal glands, so decrease in lacrimation. This also results in dry eye. So mostly we can recommend saline drops, or even there's this natural tears that we can also recommend for them. Then we have decrease in color sensitivity. So they have altered color vision, and then they have decreased even reading, and then having this color discrimination. They have that decreased ability. So, and then lesser dark adaptation. So the slowing of the eye's ability to adjust to darkness. You realize that sometimes when you are in a dark place and then you are going to a lighter where there's bright light, we that we are not older or we don't have really much of an issue with our eyes, sometimes we can even have some reflection after some time, before we can now see whatever is available for us to see. Sometimes also, right from a lighted area to a darker area also, you need some adjustment before that. And so older adults have that kind of decreased ability. And then increase intraocular pressure. Increase intraocular pressure. So mostly they will need evaluation from the ophthalmologist so that they wouldn't have glaucoma and all those visual losses. So they have to be go for checkups for evaluation to detect visual loss and then glaucoma. Of course, generally also increase sensitivity to glare, and then we will advise them not to be glaring so much. That's one of the advice we have to be giving them, not to be glaring so much because they have that increased sensitivity to glare. And then, of course, getting decreased sensitivity to light. Mostly also, the HPTs and the diabetics, they have retinopathies. And so they also have this kind of issues. And so when they come in with diabetic retinopathies, we should know how to encourage them and then advise them. Any necessary implications you want to consider? Right, so we have to urge older adults to schedule routine eye examinations, assess their ability to perform activities of daily living, and then consider safety measures like adequate lighting, gradual change from light to dark, avoid glare, use of stair rails, yes, and then saline drops relieve dry eyes, and toxic substances and medicine with labels that are readable. It means that when we have that available, we should label it with bold writing so that they'll be able to see and then they wouldn't go take it and then causes any complications for them. Now we have our taste, smell, touch. So decreased taste, a diminished sense of taste. However you say it there, so hypo what? Hypo what? Hypogeusia, right? Yes, I said it's not my language. Of course, hypogeusia. So it's also a normal occurrence for the older adults, mostly after the age of 70. Mostly after the age of 70, they have the diminished sense of taste. Of course, there is always a decrease in taste buds when they get to that stage, they have gradual decrease in taste bud, and then that would decrease their taste threshold. Mostly, they have a threshold for an effect for protein, salt, and then sweetness. So if you cast your mind back to your parents who are old and you're going to visit, then you realize that, or maybe they came to visit you. They like taking salt, sugar, and then of course meat. They like chewing meat a lot as well. So it is part of their aging process. So sometimes we should be calm with them and then try our best to advise them because they have that higher threshold than the young ones. If they have taste defects, of course, it will lead to lack of appetite, which will lead to weight loss, malnutrition, and then, of course, impaired immunity, and of course, disease conditions. We have atrophy of the olfactory bulbs, the shrinking and decline in the size of the olfactory bulbs in the brain as these persons or these older adults get uh, older or as they grow. And so when they get to that point, then what happens? Mostly they have that conduction of nerve um, impulses as well. It gets slower conduction of nerve impulses. And so it happens when there is a degeneration of this myelin sheath. It's also a very key factor. And then it slows their reflexes. It slows their reflexes diminish function of the peripheral nerve. Generally, they have these symptoms when they experience all these touches. They have the diminished function in their peripheral nerves, and then it goes to prevent them from sensing danger and sensing trauma. And so it leads to this loss of physical sensation. Physical sensation. So if there's danger, well, they feel it though, but the ability for we, the young ones, to feel it better or faster is quite diminished in these older persons. All right, so what do we do? What do we do for them? Tests, we have appetite enhancement strategies, check dentures for fit and cleanliness, inspect mouth for ulcers or gingivitis, Identify possible offenders known to affect taste. So if there's anything else you want to do with the reason why you don't want to maybe taking anything or they are taking much of something, then you can identify and assess and intervene and encourage fluid intake. Any addition? I haven't seen any addition in the chat box. Are you following, my dear? Any addition? Any addition? Taste any addition? All right, so let's move on to smell. Smell. Implement safety precautions. Placing natural gas detectors, placing smoke detectors, date and label food containers, house cleaning and personal hygiene, encouraging daily waste disposal to prevent garbage smell because they can't really smell so much. That's to encourage that. Then touch. Focus assessment on the impaired sense of touch, the intactness of the skin, and then safety risk. Dental. Dental gums become less elastic, yes. The and then less vascular as well. So the enamel becomes weak. Disease of the gum happens to decay, weakened gum. They all happen. Okay, so they have experienced that. Even we that we haven't gotten to that stage. All the time we go to the dental clinic, there are issues, right? There are issues with us. So it happens. Gum recession. Gum recession. This is where the tissue around the teeth pulls back. It pulls back, exposing parts of the teeth that are normally covered by these gums. And so it can lead to sensitivity and then, of course, increase in the cavities as well, and then other dental problems. And then loss of tooth. Loss of tooth are also part of their problems. Nursing implications, encouraging visit to the dentist, brushing of teeth, and then mouth gargling. Any addition? Any addition? All right, so now we are moving to the systems. These ones would have to come in when we are talking about the nursing interventions and implications, please. All right, so integumentary system. We are having skin dryness here. Generally, connective tissues become loose, so the skin becomes loose. Some even have skin cancers. Yes, it's part of the condition, their common illness due to, of course, exposure to the sun. Some have chronic wounds that are even neglected. Mostly as it's a loss of subcutaneous fat, mostly due to a thinning of the layers of the skin. So loss of the subcutaneous fat causing thinning of the dermis. It happens. So which one do I have? Educate them on the importance of avoid holding eyes or cold objects. Of course, with the touch, right? Yes. With their bare hands, yes. With the touch, that's true. That's very true. Right, so decrease elastin associated with wrinkling. Of course, well, as we age or as the people age, the body, of course, produces less collagen and elastin. You know that this collagen also helps in the resiliency of uh, organs. Yes, so it leads to the sagging of the skin and then the wrinkles. So the skin, of course, we know is an organ. And so when the collagen production is reduced, it gives that sagging effect and then wrinkles. Then less effective as barrier. The skin, yes, less effective as barrier, and so sensitive to pressure and trauma. So we've seen that also here. Sensitive to pressure and then trauma. So when it's less effective to barrier, meaning it loses its ability to protect the body from external elements. So like this trauma, any irritants, anything that will affect. So decreased sebaceous glands, and this causes dry, flabby skin, which is also prone to itching. It is prone to itching, so we have it there. And then graying hair, hair loss and baldness. Baldness mostly affects the males. So graying hair, hair loss, the hair thins. And of course, the color also changes. It tends to fade. And so it grays. It grays, of course, because of the pigment loss, and then hair distribution pattern also changes. And so we have this male who become bald. And now their baldness, they've made it as fashion where they'll make it shiny and then they will dress nicely with it. You can just hit it if you want to tease them. All right. And then decrease melanin. And so there's color changes and hair loss pattern. Yes, tend to be it tends to be hereditary. So the color changes, of course, and then yes, and the color changes. So they have the melanin decreases. Melanin decreases, and so they have changes in color. And then yes, the patterns of the hair as well becomes a problem. Facial hair increases in women. We see that a lot, right? We see that just yesterday I started plucking some small hair from my chin. Most of the women, if they'll testify, most of them have small hair, very small. You can't really, so unless you're so close to them, unless they have told you that, oh, there's some hair here. So yes, facial hair increase. So as it means that as we are aging, if you have experienced these things, then it means they are going to be higher when we grow. We should try our best. They say that we shouldn't shave, right? Because if it does happen, then it means that we are more or less getting into uh whatever hormones, male hormone. I don't know why they have that reason why it happens. But they say when you have that facial hair, we shouldn't shave. Maybe now we can wax. Maybe waxing will do the thing. All right. So yes, adipose tissue redistribute to the waistline. Increased probability of pressure ulcers. Yes, due to decreased blood flow and then the thinner skin. Then vascular lesions. So cherry angiomas are there, small bright red bumps on the skin. They're small. They're not like petechia. Very small, like sort of dotted one. So cherry, like a cherry, yes. Like a cherry. Petechia is quite spread. Petechia, because of cardiovascular, I'm sure all of us know what petechia is. And telangiectasia, spider veins. That's what the spider veins. Those who are fair, you can see some on them, especially on their thighs. Yes, but then yeah, it is common. It is common. Spider veins or telangiectasia, a very small widened spider veins that appears here, as I said, on the skin, their thighs. Yes, it's common in even younger ones, but as they age, they have it, they experience it a lot. And then in order that when you see that, then maybe it is in a way leading to a condition. This condition, when you see that on them, you have to probe further and then assess. All right, so another one is here, onychomycosis. So this is also not my language. So however you mention it. So it's a fungal infection of the toenails, the fungal infection. Then decreased number of blood vessels causing decreased response to injury and then thermoregulation. So okay, somebody, I just saw something, androgen, right? Androgen is the hormone. Okay, for the hair. All right. For the hair. For the hair, okay. No, I'm just trying to say that you don't know. They are saying that if you shave it, it comes more. So what is the shaving, that external thing that I am using to shave? What has it caused, or why? What is the link between that and that hormone in me? Because I haven't taken anything inwardly. I don't know whether you got the question. Okay. Now, common skin problems. Common skin problems. So yes, skin cancer, pressure ulcers, skin tears, and cellulitis, fingernail and toenail condition. These are the onychomycosis we just saw. There's also onychia also there. Skin tests mostly it's not like a very particular condition, but let's say they've even come to your end in your facility, you've even given them IV maybe cannulation. Now you want to take the cannula out, or even if they have a wound, there's a plaster, I want to take it out. Sometimes if attaches to their skin, because their skin is now frail, very weak, very thin, sometimes it tears as part of you taking off the adhesives. So it's more or less some of the things we have to just look out for. All right, nursing implications. Can we come in here? Who set the pace for us today? Nursing implications. What should we do? Yes, my dear, come in.
Okay, I think we can advocate for them getting skin moisturizers and those things to prevent skin dryness
Very
and
good.
ensure that they take adequate water to ensure that they are well hydrated. Yes,
Very
thank
good.
you.
Very good. So skin moisturizer, that's very good. That's very good. And then adequate fluid, right? So that they stay well hydrated, well hydrated. That's great. That's great. So somebody is also saying Saturday, good turning in bed. Yes. So how good is the good? So every 2 hours, right? Ebenezer upon
This
Eben.
this time,
Yes.
I,
Yes.
yeah, covering all visible wounds.
Yes. Covering all visible
Dressing them up,
wounds. And then
dressing them.
and
Sorry, dress.
dressing them, yes, using aseptic measures. That's great. That's great. So we don't, for them, there's nothing that is small, right? So don't think that, oh, this is very small. Let's just like ask some few cuts or some small cuts, you think that it will just go away. But for them, you have to be extra careful, right? So covering all wounds, caring for the wound aseptically. Care for the hands and feet and nails. Yes, feet and nails. And then that one's when we are doing it, we have to be extra careful not to cause any injury. Yes, fingernails care to prevent injury. Anyone here? Yes, Eben, you finished talking or you want to talk again? Then David.
Okay, we should change their soil diapers frequent, especially those who have incontinence.
Yes, we should change them, right? If they saw, we should be assessing whether they saw themselves and we change them. That's very true. Especially, yes, those who have incontinence. And then incontinence is also one of the major problems of these older adults. That's very good. That's very good. All right, so this and then what I'm sure is the same as what I have here, or you've added even more. Avoid wearing tight sandals. That's true. Yes, musculoskeletal, they have problems with the hallux, valgus bone union, calluses, and then the cones. So they have to, yes, avoid these tight sandals. Oral care, yes. Oral care, that's it. So personal hygiene generally with the skin, it is very, very important. Very, very important. So instruct clients to avoid excessive use of soap, hot water, and brisk rubbing when bathing. Bathing to prevent infection, yes. Avoid harsh creams, yes. So clean bed before sleeping. So they should avoid what? Using harsh things, generally. Generally. Pat skin dry instead of briskly rubbing it. That's how we do, right? That's how we dry ourselves when we bath. But then ideally, we should be patting it dry. So for them, we should encourage them to do that. And of course, if we are doing for them also, we should do the right thing. Then, yes, ensure good lighting system and well-organized room. That's great. Yes, that's great. Prevent fall. So that'll be for both the integumentary and the musculoskeletal as well. Lubricate the skin with a moisturizer multiple times a day. Dry skin causes itchiness. Dry skin causes itchiness. Avoid prolonged pressure on bony prominences, of course. You want to prevent pressure ulcers. Protect skin from temperature extremes. So either cold or hot. That is why they shouldn't be bathing very hot water or even very cold ones. So extremes of temperature, because of thermoregulation, they can't even identify whether it's even very hot that they can't, that will even cause injury. Soak nails before trimming. Soak nails before trimming, just to prevent injury, right? Clear grounds provide safety, yes. Ensure good lighting system and well-organized room. All right. And then, yes. And then adequate nutrition. Adequate nutrition is also part. So dress appropriately for weather and climate. Protect skin from sun exposure and risk of photo damage. That's sun damage, right? Evaluate and manage incontinence. Yes, somebody rightly said that. If soiling occurs, the skin should be cleansed per routine. Plastic-lined bed pads should not contact the person's skin. Yes, and then monitor nutrition. Provide vitamin C and zinc to promote skin healing. Yes, generally the antioxidants, but it's not necessarily limited to that, right? Proteins are also part. High caloric diets are also part, especially after you've assessed the patient, you realize the patient need all these things. Of course, as we said, their collagen is reduced, so they will need protein. Adequate fluid intake, somebody rightly also said that. That's great. Thank you. Then we come to our cardiovascular system. How will a nurse do to help an aged who bleaches his or her skin, and upon education on its effect, that person doesn't want to change? Okay, who will help us? The question is, how will a nurse help an aged who bleaches his or her skin, and upon education on its effect, that person doesn't want to change? Can somebody come in here to answer this question for us? Yes, Eben.
Okay, sister. I think change takes time. It's a gradual process. And
Mhm,
then if you approach it in a certain way and then she didn't listen, you need to find um other way. There are other ways that you can go about it. You can you can show pictures, videos, and all that to make her have a feeling like a visual experience of what can happen to her if maybe she has a cat and then they want to suture and all that, and then the risk of getting skin cancers and other conditions. But it takes time, and then the person have to have more time because when they get to that age, they are very adult. So
mhm.
that's my view.
Okay,
Thank
that's
you.
right. That's great. That's great. Somebody also said keep educating. So, Priscilla, I want to,
Yes, madam.
yes.
To add up to what my colleague said, just as he said, you can give some handouts that shows what will be the end of the bleaching. So maybe these are pictures of someone who bleached, and at
Mhm,
the end he got some cancers or something, skin cancers and the rest, as my colleague said. But then nurses act as counselors. You can't force decisions on your patients. So
mhm,
after all the education, then you leave it to them to make their choice.
mhm. Okay. All right. That's great. That's great. Thank you very much. Hamdia.
Hello, madam. Please, to add up to what they said, you can also educate or introduce them. If an old woman is bleaching, that means she's not very old, like she's a little bit trendy. So that means you can educate them or introduce them to this skincare routine and this anti-aging and safe way of taking care of their skin instead of using the harsh chemicals and products.
Mhm. Okay,
Yeah.
that's good. It's all about, thank you. It's all about education, right? So, Hamdia, Priscilla, Eben, they're all saying that, of course, and then Albert and Mary over here in the chat. Mary is also saying you first ask why she wants to do that, then you reassure that beauty is not only physical, complement her physical appearance and educate on the side effects. So it's all about education, but the approach is also very, very important, right? And then we also know that we have to make patients make an informed decision. And so with our informed decision, we have made them know about the side effects. You're talking about videos and pictures. And then even if there's anything surgical we want to do for them with these kinds of what he or she is doing, it would have an effect on him or her. So we educate them about the risk. Of course, there's no benefits, right? So all the risk involved, so that after everything, if still she or he wouldn't want to stay clear. But definitely, if we really educate well, showing pictures, showing videos, telling them about the consequences, the risks, especially if they are involved with any skin uh, condition where they would have to have an intervention in the hospital, it will cause a lot of problem. And I'm sure that um, they would listen. They will listen. As I said, skin bleaching is not one day thing. So you realize that maybe they have done it for a very long time. And so need gradual counseling. Gradual counseling. Can you imagine everybody sees that person to be fair? And then maybe some years ago the person wasn't fair. Now you want her or him to stop whatever cream so that later somebody will say that, hey, so this guy wasn't fair or this lady wasn't fair. It will be a problem. So it's gradual. Gradual, you have to really educate them continuously. That's great. And then can you also recommend cream that is not harsh to the person? Well, you can. You can recommend, but you can't also, of course, force it on the person, right? You can. All right, so cardiovascular system. For cardiovascular system also, I think we've done a lot in your medicine and then your surgery. So most of the conditions are in relation to decreased heart rate, decreased cardiac output, most especially increased atherosclerotic plaques, right? So for decreased
You
heart,
see, I believe that
banana, they are easy to food than those banana.
you see,
is that a problem,
as a man,
Emmanuel?
as a man,
All right, so decreased heart rate. There's always a decreased heart rate, and then a slower heart rate with response to stress or exercises. That's one thing we should know. It's a generally, yes, there's a decreased heart rate, but there's a decreased resting heart rate or resting, yes, heart rate, and then decreased heart rate with response to exercises or stress. And then we have a reduced cardiac output. It has a lot of factors. There's a lot of factors for reduced cardiac output, but it occurs when the heart cannot, of course, pump enough blood to meet the body's needs. And there are a lot of factors that causes reduced cardiac output. A lot of factors that causes, and of course, within the cardiac, not even necessarily only the cardiovascular system, but there are lots of factors that causes reduced cardiac output, the inability of the heart to pump blood to meet the body's demands. Then we have decreased contractility of the heart. That's the main thing. Decreased contractility of the heart. So of course, the myocardium will be weaker and cannot pump enough blood as it should. And so it leads to reduction, of course, in stroke volume, and then the cardiac output. So this will come in here again. And then increase atherosclerotic plaques. This one also can cause a reduced cardiac output. So we know that with our coronary artery diseases, peripheral artery disease that we've learned previously in our medicine said, we realize that buildup of lipids, right, causes plaques within the arteries. It causes plaques within the arteries, and then in a way, of course, it causes it narrows the arteries. And so when it does that, then blood to the heart is reduced, and so it causes reduced cardiac output. And then that means that there should be an increased blood pressure to compensate this. And then impaired coronary artery blood flow. So yes, the increased atherosclerotic plaques will lead to impaired coronary artery blood flow. Of course, if the plaques are in the coronary arteries, then stiffening of the heart valves, valvular stenosis. So if you remember that condition you learned also in your medicine surgery, it also causes reduced blood flow. It causes arrhythmias, heart murmurs, anginas, and a lot. Then increased blood pressure. Yes, so we just said something that even when there is even with this atherosclerotic plaques, with this impaired coronary artery blood flow, all these are something for compensation. The blood would have to increase more or pump more. So increase blood pressure. Increase slight increase in the size of the heart, especially the left ventricle. That is also one of the common things we experience when we take a chest x-ray. Then diminished ability to respond to stress. Diminished ability to respond to stress. So increase of this peripheral resistance and decreased cardiac output, of course, would cause this increase in BP, as I've already said. And so generally, even when they walk for some few minutes, they have increased demand for oxygen. And so it also even increases their pulse rate. So generally, they have decreased physical demands, and then activity of the heart also decreases. So nothing, well, this is common disorders. Common disorder. I'll try my best and change the title before, or the heading before I send it to you. So this is common disorders. So yes, hypertension. Okay, yes, hypertension mostly it's a side effect of some conditions and also some medications. Generally, we have the hyperlipidemia, we have chest pain, we have angina, myocardial infarction, valvular heart disease, and then the PADs, peripheral PVDs, rather, peripheral vascular disease. But then one of the examples are the peripheral artery disease and then the coronary artery disease, as well as venous insufficiencies. They are part of the examples of these things. So what do we do? What do we do? What do we do? I think I should minimize this and then ask first. Cardiovascular. Cardiovascular, there are a lot to do in cardiovascular. Yes, I handle.
So with the cardiovascular, you encourage them to involve in this minor activities, or activities that are not vigorous, the minor activities, and they should watch the intake of too much sodium and that of oil. They should be very careful in type of foods that they eat, and with that, I think they will be healthy, or they will live longer while before. Thank you.
That's great. Thank you too. So yes, encouraging low sodium diets and moderate exercises, right? Exercises that is monitored. They have to be monitored. That's great. That's great. Come to for.
Okay, madam. So, in addition to the diet and the exercise too, we should also encourage them to go for regular medical checkups so that some of these things may be identified on time and managed before it worsens.
Yes, so very, very key, right? They have to be going for checkups, regular checkups. Very, very key. That's very, very important. Then even with the nutrition, they talk about oil, right? They have to reduce the intake of oil as well. That's very, very important. And education on adherence to their prescribed medications, yes, that's true. Most of them now, I don't know what is happening to these older adults in terms of this thing, cardiovascular, when they have given them their medications, they go out there, and then now there's medication, 3P garlic, what was Spanish? My mother will come and tell me that, no, buy me 3P garlic. And they say there's Spanish garlic mixture or something, something. And then you read on it, and you realize that they say it causes hypotension. So they will think that, oh, because it reduces blood pressure, then that's it. But no. So it is up to us to try our best to talk to them very well, as to them adhering to their treatment regimen, not looking elsewhere. not looking elsewhere. I don't know the effect of all these things, especially when they combine this two medicate, a different class of medication. Their diets, right? Yes, you have to check their diets. Educate them on avoiding excessive into over-the-counter, yes, medication. That's very true. That's very true. That's very true. Beneza, do you have anything to add on?
Yes, sister. I wanted to add, they have to limit their or avoid their intake of um, smokes or alcohol.
That's true. That's true. That's true. Avoiding alcohol and smoking. Very, very key. Okay. Jamila. Yeah, Jamila, add on and then let's move on.
Madam, please, some of the old people, the aged, when you tell them to stop smoking, they take the tab, that thing inside the cigarette, they chew it. So I think that one too should be educated, because if you said they should avoid smoking, they can even take it to another stage, especially those in the northern part.
Okay. So now they won't smoke, but they chew it. Even southern, they do it. Even suggest that maybe those ones you wouldn't see with the older adults, but the guys here, I'm sure about 1 or 2%, you know what I'm talking about. They have it in toffees, they have it in biscuits, right? They have it even in Don Simon's, our paper, the normal paper drinks. They are in, and they are really making justice to it. So, so yes, we have to really educate them. When we are educated, we should educate and educate well, right? Because yes, I've stopped smoking, but I'm there and I'm chewing my thing, right? So that's true. That's true. That's true. That's great. Thank you very much. I am blood. Do you want to add on anything?
Yeah, to also add to it, we have to also encourage them to either maintain a healthy weight and also try to manage their stress in so do maybe in meditating, doing what they like, maybe their hobbies in order to relieve their stress. And the weight management, I think we spoke about it. That's the exercise and eating a well-balanced diet. Thank you.
That's great. Thank you very much. That's great. Then Eben, come in and then we move on. Okay. All right. So
Okay, sister. For mine, I'm kind of confused here because for what I remember, it's like when they smoke the marijuana, the hemp and the ashes and the weeds, it can cause lung problems. And then if an individual is using those herbs, if the person is using it but not smoking it, it does not predisposes them to lung conditions. That is what I think I read somewhere.
you
So
are
I'm kind
confusing
of
yourself, my dear. Do you know why? We are talking cardiovascular, and when you're talking cardiovascular, it is the effect of nicotine. It's not necessarily the lung, the smoking, but the ingredient, the substance that is inside. What is the effect of nicotine on our blood or in our, yes, blood or our blood vessels? Are you getting it here? I won't answer that. Go and find out that effect of nicotine on the blood vessels. So, yes, if it is in relation to respiratory, and then we are saying that, oh, they should stop smoking, even into respiratory, one of our interventions, we will say that avoid or stop. So it means that it's not necessarily only stopping, but even if you can avoid it within the area, like air pollution, it means that we are protecting our lungs, right? But in terms of cardiovascular, it's a different ballgame. Yes, so we have vasoconstriction, right? Yes, and what is the effect of that as well? Are you getting it?
yes, madam. Thank you.
All right, so yes, so we would have some few ones here saying that we really have to go by our history taking a lot. Avoid herbal medication, which may cause kidney disease leading to hypertension. Yes, that's true. And somebody was asking about they talking, they should reduce it. My dear, they can't reduce it for talking. And talking, why can talking cause any problem with cardiovascular? And for them, when they are aging, they talk. They like talking. So we have to really listen to them. All right. So we have to take good history, very good history. And if we take a complete history of our patient, past medical, past surgical, social history, family history, and all that. Yes, in terms of cardiovascular, it is very, very key. Very, very key for us to know any underlying conditions or any family or familial or hereditary conditions where it can affect them on one or the other. Again, source of history other than the patient should be very well noted. It should be very well noted. So nicotine can increase heart rate and blood pressure. That's training. All right. Okay. Thank you. Right. So source of history. So this was, I think, it's helping those of us who haven't said for it to read and understand. So I wouldn't read it and let me just move on. So if it's a family member, any other person, whatever they also say, for this part of Condi system, we have to make it a key. We have to make it a key so that we note it down and know if it will affect us or help us in assessing and intervening for our patients. Then carefully note the chief complaint, the main reason they reported. They reported chest pain. If it is chest pain, then we note it down. Presence or absence or maybe dyspnea, we note it down. If it's palpitation, the chief complaints, whether it's edema, cough, fatigue, and all that, pain in extremities, all these things will tell us something different. And so those chief complaints, you have to note them down. And then, of course, we do a comprehensive review of the systems. And so we do a physical examination, a clinical examination, and then based on each system, we also assess. So a general and complete examination is done for these types of older adult patients. Then what we rightly added, I said, there's a few we would have to add on. I think all of them are even here, what you said. So advise early to avoid and stop. So here, avoiding and stopping is also part here. And then encouraging daily exercises, which is monitored and is a moderate exercise. Moderate exercise. Promoting healthy diets, low salt, low cholesterol, calcium-rich foods. Of course, protein-rich foods are part, antioxidants are still part over here as well. Encouraging the client to control his weight is also key. Scheduling regular checkups, advising to stay mentally active. And mentally active, day talking is part of their being mentally active. All right, socializing with others is also part. Okay, so chronic stress associated with excessive talking rather can indirectly impact health issues on the heart. Chronic stress. Okay, so it depends. Yes, so well, so if they are in stress and you are talking about chronic stress, so it means that at least it is qualified, right? Well, it is qualified generally. That's what you are talking about is qualified. So if that is the case, then you would ensure that the rest is key in cardiovascular, but then depending on the presenting complaints and what they have brought, and even with your assessment, you can tell them not to talk so much, then they can rest. Respiratory. They're saying when you go to the outside world, they call it respiratory. So those of you who will travel after here to be an RN over there, most of the things we mentioned here changes. All right, so encouraging, yes. High potassium diet, yes, that's true. High potassium diet. All right, so now respiratory. All right, sorry. Loss of muscle tone and elasticity. Loss of muscle tone and elasticity. So the lungs appear very large. Well, no, it appears larger than usual, and it's due to loss of elasticity, right? And so there's stiffening of elastin, and then the collagen connective tissues. You know that collagen is found, of course, in the connective tissue, and then the lungs becomes very rigid as well. Then there's decreased ciliary activities, and that also increases infection. It increases infection. There's residual capacity is increased, that causes acidosis, and there's decreased alveoli in number. So there's a reduction in the number of the alveoli that leads also to a reduced infection of the lung, and then it lowers oxygen levels, and then when it does that, then it means that there's an increase in breathing difficulties. Then there's decreased cough and laryngeal reflex. Decreased cough and laryngeal reflex. And then when this happens, it prevents aspiration. It prevents aspiration. And so this decrease in these reflexes risk. Did I say it prevents? It causes risk for aspiration. It causes risk for aspiration because the reflexes rather prevents aspiration. So when it reduces, then there will be aspiration, and there will be even choking. There'll be other respiratory infections, even including pneumonia. It happens when these cough and laryngeal reflexes are reduced. Then we have reduced chest wall compliance. And so there's a decreased respiration as well due to this chest wall deformities. And then there's a decreased gas exchange. So maximum breathing is reduced. Patient is not able to exhale fully. Patient wouldn't be able to exhale fully. And so slower amounts of oxygen carried by the blood, and then there's less efficient gas exchange. So there's hypoxemia. So there's low oxygen in the blood. And then there's increased chest wall stiffness. There's increased chest wall stiffness. The chest wall loses its flexibility, and so it also makes breathing difficult. And it can also lead to reducing the lung expansion, and then decreasing respiratory efficiency. And this also causes respiratory infections. And there's weaker respiratory muscles. So all these things generally reduces the lung capacitance, or the capacity of the lungs, and then this helps in, or it makes the patient breathe faster, and so when it happens, patients are rather prone to infection. When this occurs. So generally, with respiratory weakness, we have the ability for them to acquire infection. So if there's ability for them to acquire infections, then what do we do for them? Common illnesses are, we have asthma, we have COPD, we have TB, we have lung cancer, respiratory infections, pneumonia, bronchitis, and then pulmonary embolism. Of course, there are a lot, but these are the common ones. What should we do? To prevent? Generally, what you said is to prevent respiratory infections. So what do we do to prevent that? What do we do to prevent nursing implications or nursing intervention. Yes, I have there.
Yeah, hello, sister.
Yes.
Okay, so we talk about avoiding of smoking in the earlier condition. That's the cardiovascular.
Yeah.
So here too, that one is we should also talk about that, and maybe they should not be at a place where there is air pollution or there is too much of the smoke and other things that can bring their this thing that can easily affect their uh, their lungs. Okay, we should also look at engaging them in regular exercise to keep their chest muscles strong.
Yes.
Yes,
Engaging them in chest exercises, right? Making their muscles strong. Yes. And then what
and
did you say? Something
also
else.
stay active by maybe avoiding laying in bed or sitting down for a long period of time. And I think with these two, we can be able to strengthen their respiratory system. Thank you.
That's great. That's great. That's great. Thank you very much, my dear. Sabina. So yes, what you are saying, that's free and minimizing air pollution, proper treatment of upper respiratory tract infection, that's great, and avoiding overcrowding. Yes, Sabina, come in.
Then we can also encourage adequate hydration, since that one will help to liquefy secretions in the chest and help with expectorating those secretions too.
Yes, that's great. So adequate hydration if the body can contain it. And then according to the patient cardiovascular health, that's very good. Adequate hydration. That's great. Yes. Eben.
Sister, ensuring proper ventilation.
Yes. Ensuring proper ventilation. Yes. That's true. That's good. Thank you. Avoiding very cold drinks, health screening and immunization. Practice proper hygiene to minimize the risk of hospital-acquired pneumonia, especially for those in healthcare facilities. Okay. Hey, Daniel. No, I haven't heard from you today.
Okay, madam.
Yeah, Daniel.
Yes, please, madam. Please, avoidance of vigorous activities that will involve too much intake of oxygen. Because that vigorous activities will mean that the client has to get too much oxygen, but as a result of the aging process, and we all know that the lungs, the capacity of the lung, or the strength of the lung parenchyma is low. It will be difficult for the client to breathe in a lot of oxygen to meet these demands.
So generally they are battling with faster breathing. They have slower heart rate rather. They have slower heart rate rather. So we have to get it clear. They have slower heart rate, right? Yes, and then the ability to even take in oxygen is quite on the low. So you are saying they should avoid, I want to get it clear a bit. Avoid excessive exercise, right?
Yes, strenuous exercise.
Strenuous exercise, of course, they have to avoid strenuous exercise. But I didn't get the reason behind it.
Okay, I was saying that we know that, like, as they age, the lung parenchyma elasticity and its strength lowers. So if they are involved in strenuous activities, or involving in strenuous activity will mean that you need a lot of oxygen in order to aid oxygenation, and which because of the weakness of the lung parenchyma, they wouldn't be able to breathe in that oxygen that will meet the demands of the body as they involved in the strenuous activities.
That's great. I've gotten it. Don't worry. All right. So Eric comes in here.
Doc, please, mine is to assist them in daily personal hygiene.
Assisting in daily personal
Hello, Doc, can you
hygiene.
hear me?
Yes, please, I can hear you. Please,
Yes, please.
I'm sister.
But I have a question too.
Yes, my dear.
My question is that, like, I just want to use this scenario. My grandmother, let's say that, like, she was old in a way that, like, when you restrict her from doing maybe sweeping, or she just hate to see something that, like, you are supposed to do and you are not doing it, she'll get up and she'll be sweeping, be doing funny things. When you even stop her from doing it, the time you realize, no, she's involved in those things. So such people, know how do you restrict them from involving in exposure to some of these things?
Oh, but it's not strenuous, is it? Is it strenuous?
Please come again.
What they are doing, is it strenuous? It's not strenuous.
Well, it's not that strenuous, but like there are sometimes she involve herself in like sweeping and the dust. When you see those things that can trigger her or give her infection, but when you try preventing her, no, when you are around, she will not do. But the moment you step out and you come, you see that she's involved in those activities.
So have you talked to her? Have you talked to her?
We spoken to her, but still she doesn't mind anybody. When you are there, she will not do. But the moment you step out, no, then she will see that she'll be doing things until like she was bedridden. And that time she was not able to do again. Then she stopped.
Maybe when this one they don't want to comprehend whatever we are telling them. Maybe what we have to do is, sorry, to give them of course increased intake of water, so that in any case if they have inhaled anything, it can also help in clearing that. Right? Yes, because if they are bound on doing whatever they want to do, even if you have talked to them, you have cancelled them, whatever, then it means that we would have to now perform any other things, prevention methods, so that even if they have, in one way or the other, inhaled any organisms or any pollution or anything, the system can try and clear it out. Is that okay? So in any case, if they don't have any condition, genitourinary problems, then we can give them fluid intake to clear up the system well. And of course, as you all say, avoiding overcrowding places and other things. If it's only about the dust and the other aspect is okay, and so she still thinks that it's good for her to do, then why not? But we should just encourage her to be taking in other things that will help supplement the other things she did or she was doing. But as you said, now she has stopped, right?
Yes, please.
Okay, that's good. Yeah, I like that.
Thank you, Doc.
You're welcome. David, I like that.
Hello,
Yes, and
sir.
breathing and then coughing exercises. Yes. Encouraging breathing and coughing. That is also one of the key key points when we want to prevent any respiratory conditions, even with cardiovascular. So deep breathing and coughing is one of the key points, right? So encouraging that is very key. Deep breathing and coughing exercise. Yes, David. David, come in.
Yeah, hello, madam.
Yes.
Yeah, I also want to talk about the regular checkup of the airway.
Yes, can you talk about it?
Most of the time, they tend to use association money. The regular checkup and assessment will assist to detect early detection, so that if there's any swallow reflex problem, we know how best we can, the type of diet we can be giving them in order to prevent aspiration money.
Okay. All right. Thank you, Mary. All right, so let's move on. Okay. So whatever you've said, we'll add it on to what I have here. So cleaning the nostrils to ensure a patent airway, allowing rest period throughout the day, avoiding exposing the elderly to cold and flu, germs, so any infections at all, right? Any infections at all. But yes, they are also prone to cold and flu, like cold. They are prone to cold, and so we have to ensure that we avoid exposing them to areas like that. Encourage plenty of fluid intake if their heart allows proper nutrition, and then avoiding smoking and exposure to smoke. Sabina, you want to add on something?
Sister, these days too, there have been some vaccines against some of these respiratory conditions like H1N1, the flu, that they take annually. So we should also encourage them to do
Immunization. Yes.
vaccination annually to help reduce
Sorry.
the risk.
Yes, that's very true. That's very key, immunizing. Just that, you see, they don't like it. I don't know whether you've experienced that. Most of them don't want to take immunizations. But yes, it is really key, right? Because if they are prone to getting that, now if we have vaccines, or we call it, some people will say vaccines, then they can go take it. I have like come in and then let's move on, okay? We have.
Okay, sister, it's a question. I think I heard you talk about them having a slower breathing,
Heart rate.
or
Yes.
yeah, yeah. So in so doing, is it advisable for them to put on masks in case they are at a place that is the air is being polluted, or they are going somewhere that you think that dust will disturb them? Is it advisable to give them maps?
Okay. So please, who answered that for us? Is it advisable to give them masks? Yes, Sabina.
So please, yes, we have to look at the advantages over them wearing the masks compared to them not wearing it. Let's use when the COVID came, for instance. In that moment, them not, putting the masks on because of their slowed breathing rate wouldn't be considered, because as it stood, as at that time, the COVID was more serious and dangerous. So depending on the situation, I think we just have to weigh the benefits of them wearing the mask to them not wearing it. Then we go for that. So if the situation demands they put it on, then they would have to. But if they don't put it on, they don't stand any greater risk, then we can let them walk around free without the mask.
Thank you very much. That's just about it. Most of the times when you are faced with patients or conditions, we just have to weigh the risk over the benefit and then we choose, right? GIT. All right, so digestive juices continue to diminish, nutrients absorption decreases. Muscle tone reduces, and then peristalsis also decreases. Yes, when there is reduced muscle tone, there's decreased peristalsis, and this also causes constipation and then indigestion. Yeah, common complaints for this point. Then the gag reflex is also less effective, and it can also risk choking, aspiration, yes, pneumonia. Yes, it also happens that when the gag reflex is less effective. Tooth loss and then gum erosion. So the tooth enamel and then the dentin erode and also contributes to this tooth loss. ACL decreases. Gastric and then pancreatic enzymes also decreases, and then when it happens, it means that there's a reduction in even taste, there's a reduction in digestion, and then when there's reduction in digestion, there's decrease in absorption, and then when there's decrease in absorption, of course, patient will feel bloated, will feel stomach will feel distended, and it will even cause even a decrease in hunger, because they'll still feel that they are full. There's an increase in fullness as well. So when there's this decrease in ACL, it causes all the digestion problems. There's decreased taste. Yeah, so the taste buds also decreases. That's the number of taste buds decreases. And then, of course, it will cause loss of appetite, and loss of appetite will lead to weight loss, malnutrition, low immunity. And there is also decreased thirst. There's also decreased thirst. Then the tip of the tongue is affected first, so the sweet and the salt is affected. So that is why they have an increase in sweetener and then the salt intake. Decrease in absorption rate, yes. So there's decrease in emptying time of the stomach and it causes distension. There's decrease in hunger sensation. So I think I've said all that just because of the first decrease in the gastric and then the pancreatic enzymes and the HCl, right? And then there's decrease in liver size and then blood flow, and then there's impaired clearance of the liver of drugs that require extensive phase 1 metabolism. And so it can cause accumulation of drug and then its prolonged effects and then increases the risk of toxicity in these adults. Common illness: esophageal disorders, dysphagia, gastroesophageal reflux disease, GERD, gastritis, peptic ulcer diseases, and then Crohn's disease. Nursing implications. Let's go. If you have any of them, can we write it in the chat box and then move on? Maybe when you get to other ones, then we talk about them again. Please write them so that we all read and learn and then add, because only the nursing implication, I only have just one slide. It should be a lot. It should be a lot. And so, and if you want to go by only that, you wouldn't, you would have about more than 100 slides. So have some points written in the chat box and then we all read and learn. Some of us also jot it down. So you have to advise clients to eat a balanced diet that is high in fiber and low in fat and processed carbohydrates. So educate them to avoid lying down immediately after eating. Yes, that's true. That's very true. Drink a lot of water. That's very true, right? So maintain a normal weight. Maintain a normal weight. So it means that you have to be checking the food and then exercises, right? Then decrease the portion of food or your push of food served at a time, meal time. Avoid lying down 2 to 3 hours after eating. That's what somebody rightly said, right? Yes. Encourage moderate exercise to help in digestion. Yes. Eating smaller, more frequent meals. That's what you said. Oh, that's great. That's great. So that's it. We have the adequate fluid intake, early eating and avoid late hours eating, encouraging them to eat more fruit for easy digestion, and then good bowel movement practices. Yes. Yes. Right. Avoiding alcohol. So stop smoking and using tobacco products, limiting the use of insects, and then encouraging to carry out daily oral self-examination, of course, and then oral hygiene, right? Oral hygiene. And then supplements. Supplements are very important. Reduce intake of caffeine, food, and spices. On drug abuse. Of course, when we talk about the PEDs, right? Over the counter drugs, all these things should be avoided. All right, so endocrine. So there is decline in the secretion of growth hormones. There's decline in the secretion of growth hormones. When this happens, it decreases bone density. It decreases lean body mass, and it also increases fat mass. You know that, yes, at a point when the growth hormone, it stabilizes. But then when we get to that older age, then it now reduces. And when that happens, these are the effects. There's increase in serum concentration of parathyroid hormone. And then this can also lead to our dear osteoporosis, even though we are not talking about musculoskeletal here. Hormones have a great deal in everything in our system. Lesser utilization of insulin, and then it can lead to type 2 diabetes, of course, with increase in age. Lesser plateau of estrogen. Lesser plateau of estrogen. When you talk about estrogen, you just quickly hit on the women, right? And so it causes reduced vaginal lubrications, of course, vaginal dryness. Then cessation of progesterone. These ones, of course, with the reduced estrogen or with other stimulating hormones, there are a lot of hormones that come in place when menses ceases. They all help in coming to our menstruation season, and because of this hormone cessation. And so it comes also with this hot flashes and mood swings and all that for our dear women, for us, and then our dear older women. Then there's decreased prolactin, and so increased refractory periods in males. And so, my dear males, if you know also this refractory period is the result of decreased prolactin. And so it's that time where immediately after orgasm, I think we meet it also in genitourinary, immediately after orgasm and ejaculation, if the man is maybe physiologically unable to be erect, or psychologically also, the man is interested in sex, doesn't want to have sex. So, or even both physiologically or psychologically, right? And then it can last from minutes to even days, and it varies from person to person when you talk about this refractory periods in males. So it's as a result of decreased prolactin. Common illness. So you have the DM, you have the hyperthyroidism, you have hypothyroidisms. There are a lot. What should we do? What should we do? Nursing interventions, nursing implications. So it can lead to goiter. Oh, which one was that, Italy? Which one was that? Which enzyme or hormone was that? I quickly.
I think that should be the parathyroid gland, the parathyroid hormone.
That was okay. And then you added on that, right? It can lead to goiter. It escaped me. I could have mentioned it as part of my lecture. Sorry. Okay, so encouraging hormonal replacement therapy. Oh, I saw one. Okay. I'm sure most of you have read it, and then it was quite interesting. It has this. Yeah, so healthy elderly patients should continue their exercising programs, while sedentary elderly diabetic needs cardiovascular assessment before starting exercises. Yes, that's important. Encouraging on hormonal replacement therapy if necessary. I like the word if necessary, right? Yes. Food supplements rich in calcium. Yes. Yes. Any other? So weight management, encouraging avoidance or reduction of alcohol intake. So because endocrine disorders often present atypically in older adults, regular lab screening is very, very, yes, important. That's true. Important for identification. That's great. Yes. So encouraging avoidance or reduction of alcohol intake, advise regular exercise, of course, on moderation, and if cardiovascular has been cleared, then refer to a dietitian for basic food and meal plan guide. Counseling. Counseling is also important when we come to the prolactin hormone with the males. All right. Musculoskeletal system. So let me come in. Are there any questions? If there are not any questions, then we move on. Are there any questions? Any questions? Any questions? All right.
Yeah, hello, sister.
Yes.
I think my mom called me. I think that was last weekend. Was complaining about my grandmom that nowadays she every minute she's brushing her teeth. That she feel the mouth is uh, it's like it's scaling. So after every minute, every few seconds, you see her with brush and toothpaste. She's she's 115 now.
Wow.
She can talk all right, but she can't walk. So that is the problem. But I told them that I will get back to them. In this case, what can I tell them to do?
Wow.
What would be the best
Wow.
answer that I can give them?
That's a big congrats to you and your family. before we answer you. Okay, so who will come in here to help him or to help us all? I'm sure maybe one of us even is having similar problem at home or maybe in our facility. What should we do? What quickly comes into your mind when he says something like this, or like with the story he has just given? What will quickly come into your mind? What should we do for him? What are the suggestions?
I didn't get a question quite.
It says his
So, sister, I think they should, if they can book an appointment with a dentist, because he talked about scaling in the mouth, which isn't a usual thing. So they should probably get her to see a dentist, and they will see what exactly is going on. That is, if they themselves have tried to examine what it is.
Okay.
And perhaps if she needs assistance with the oral care too, they can also give that one too.
Okay. Okay, that's good. All right. Any other? All right. So yes, there should be an assessment, the first place, because at this age, there will be a lot of contributing factors. There are a lot of reasons. We can't pinpoint just one particular reason for this, right? There'll be a lot of reasons. So it's either there's a problem with dentition, so he has to go for dental checkup or dental therapy, or maybe there's a deficiency somewhere. So that one, so she'll need an assessment. Or maybe it's even there's even even our normal flagyl, for instance, you take it and you have a metallic taste, right? And then you have this kind of peeing. So maybe even a side effect of a medication. So she needs a assessment. Or even let me come to our what we learned in our psychiatry. Maybe it has gotten to the stage where she feels that because I'm growing, the little thing I feel something in my mouth, I want to brush it. She's getting to that compulsive disorder. So there should be a general assessment on her, right? Then afterwards, we will think of, if based on the assessment, they will know what they will find out, and then they will do an intervention for her. Okay, my dear. I hope that's great. Okay.
Thank you.
Thank you too, my dear. Sometimes also it's just because we know that it can be one of the normal agents, right? So because we have learned that the gum, it pushes back, right? Exposing the teeth as well. So because of that, she feels that pinning within the teeth. So it can just be the normal thing, but just to be on the safer side, let us just assess, and then if we go and then we come clean, and that's it. You just be with her at home and be talking, listening to history. That's great. All right, so musculoskeletal. So yes, generally most of the problem for musculoskeletal is the problem with the gait, and problem with their joints, and problem even with bone density. So that will cause other symptoms to follow up. So there are even foot problems as well. The hammer tools, the corns, the calluses also come in here. It even contributes to this gait, which is unsteady. It can happen, can cause that. Yes, and this bone density, for instance, also, if there's decreased bone density, patient will also be even though we know that there's a hormone that can cause that, but patient will also be at risk of osteoporosis. And so generally also these patients with musculoskeletal conditions or older adults who are experiencing degeneration of this system, mostly they abuse insects. They abuse it, and so that also results into PUD. And so we have to be careful if they complain of any joint conditions with that, or any joint pain or any unsteady gait or whatever. We would know how to assess them and how to even caution them not to be using this or abusing this insect, right? All right, so we have muscle atrophy, decreased muscular strength and function, muscle atrophy, and then it causes decreased muscular strength and then function. We have joint degeneration. Yes, we have joint degeneration, also at risk of osteoarthritis. We have decreased range of motion in some joints, decreased range of motion in some joints, and then we have decrease in height. Yes, decrease in height, generally that's decrease in height. We have increased postural sway and difficulty maintaining balance. And then decrease support. So as in maybe some movements when you are standing upright, that sometimes there are some movements, or even when you are doing something in an upright position, they don't really get it right. So they have that increased postural sway, and then of course difficulty maintaining their balance whenever they are performing anything. Then there's decline in numbers of muscles, resulting in reduced muscle mass. And this can also, yes, in a way still affect the muscular strength and then its function. All right. Common illness: osteoporosis, osteomalacia, osteoarthritis, Paget's diseases. What should we do? Promoting diets adequate in calcium, vitamin D, proteins, reducing or eliminating smoking. Please, I want to have your charts. Reducing and eliminating smoking and alcohol intake, encouraging daily exercises, stretching 10 minutes per day, active range of motion exercises, weight bearing, even if they have pain or anything in their joint. Of course, when X-ray has cleared that it is not anything fracture, then it means that they can do their weight bearing. But if it's fracture, then we know we have learned fracture instead. We know how to intervene when there's fracture. But if not, then yes, we can encourage weight bearing exercises. Then monitor safety risk. Right, take frequent break and schedule repetitive, prolonged, or static activities. Yes. Standing, walking around, or changing your posture. Yes, every 20 to 30 minutes helps relieve pressure on your joints and muscles. That's great. Encourage the use of support braces. Yes. Or even walkers, right? Any assistive devices in walking, you have to encourage that. Then maintaining a healthy, balanced diet for good bone health to prevent osteoporosis and falls in later life. All right. So eat food rich in vitamin and calcium. Okay. So nervous system. So degeneration and atrophy of neurons. So there's lots of neurons in the brain as it happens. The brain and spinal cord also loses nerve cells and atrophy, right? It's the weight of it also reduces, and then the nerve cell begin to pass messages quite slowly, and so there's also loss of memory, especially, yes, the recent memory, loss of memory. But these ones will be the older, right? The old, right? Yes, get into that. But yes, maybe also mature old also, sometimes they also experience this. Reduced concentration ability. So as a result of the reduce in the nerve cells passing messages slowly, when that happens slowly, then it means that there will be that kind of reduced concentration as well. Decreased attention span. So that also, yes, decreases cerebral blood flow, then it loses memory, reduces concentration, decreases attention span. These are all in sort of a subset. It's all embedded in each other. Then less nerve acuity and sensation. Then unaware of tissue trauma. So more of the touch thing that we explained earlier on. Then decision-making and judgment ability remains intact. Ability to learn is intact as well. But there is decreased muscle coordination, decreased ability to perform fine motor activities and those requiring coordination. So there's slowing of coordinated movements and then deterioration of balance mechanism. There's decline in ability to even concentrate on the one task, and that is there as a result of those reduced coordination. So there's decreased muscle coordination leading to generally reduced coordination. What should be some of the common illness? dementia, Alzheimer's, vascular dementia, Parkinson's, stroke, and then multiple sclerosis. What should we do for them? What should we do for them? So, right, so clients must remain active. I'm still waiting to see some in our chat box here. Clients must remain active and engaged in life. We're talking about the nervous, right? Yes, okay. So the elderly must develop hobbies and interests. I still want some from your chat box. Eat a well-balanced diet. Avoid stress and anxiety. You have to enjoy life, right? Stress-free life. Physical exercises to remain or become fit. Stay connected with at least one person daily. And then encourage a consistent bedtime routine. Speak to them in simple, understanding words. Yes. Simple, understanding words. And if you have any other thing that will make your conversation interesting, then we can add it on. Encourage enough sleep. Enough sleep. That's very, very important as well. All right, so genitourinary. I think that's the last system. Genitourinary. So decrease blood flow to kidneys. Decrease in renal function, the GFR with prolonged half-life. Generally, for the genitourinary, there's narrowing of renal arteries. So this narrowing of renal arteries will cause this decreased blood supply to the kidneys. And so it will cause decreased blood flow to these kidneys. And so make the kidneys shrink and becomes less efficient, right? And so this decrease in renal function, including the GFR, with prolonged half-life of drugs, there's generally a decrease in renal function, yes, over here. And then it can lead to increased risk of fluid retention, toxin buildup, and even electrolyte imbalances when this happens. Then there's inability to concentrate urine. So yes, there's decreased tubular function as well, and then it impairs the kidney's ability to concentrate urine. And so this can also lead to fluid and electrolyte imbalance. And then, yes, of course, risk for dehydration. There's bladder muscle weakness, and this causes bladder capacity declining, and so there's retention of urine, and then mostly for our dear males. There's increased nighttime production of urine. This is generally for our males here. Increased nighttime production of urine. And so there's increased potential overflow of incontinence and urine retention in men. So the retention has come in here where we talked about the bladder capacity being declining, or the bladder muscle weakness here. So that is for our dear males. So there's increased nighttime production of urine, and then there's potential overflow of incontinence leading to, and then urine retention. There's diminished ejaculation, longer refractory period after ejaculation. So we'll meet it here as well. There's increased incidence of erectile dysfunction. There's decreased libido. There's prostate enlargement. Of course, in some men, right? Not all men. And so mostly these are regular checkups are also key to prevent some of these things. For females, there's decreased libido. There's decreased libido, or urge for sexual activity decreases. There's body fat increases in the trunk. So we have to hit the gym if you want to grow up, and then we don't want to do BBLs, then the stomach will be very big. It's just normal. I don't know what, for some reason. Then atrophy of breasts. There's atrophy of breast. There's atrophic vaginitis, of course, due to decline of the estrogen. So mostly it is our estrogen that declines, that also affects most of the things we as women also experience. Vaginal dryness will also come in here, right? There's increased incontinence, and then this is also due to our overreactive bladder, or the trouser instability. Common conditions. So BPH, benign prostatic hyperplasia, acute and chronic renal failure, urinary tract infection, urinary incontinence, and then cancers. Yeah, cancers. So what should we do as nurses? Retrograde ejaculation. Nursing implications. Monitor intake and output. Unless a patient is on fluid restriction, he should be offered fluids frequently. Fluid intake should be no less than 2.5 liters every day. Reduce salt intake in the diet. Personal hygiene. Yes, maintaining personal hygiene. Adopting a balanced diet that includes plenty of fruits, vegetables, and whole grains. Avoid food that may irritate the bladder, yes, such as spicy foods, citrus fruits, and caffeinated beverages. The reproductive system. So vaginal narrowing and decreased elasticity, that's for the females. And this causes painful intercourse, vaginal bleeding following intercourse, even delayed orgasm, vaginal itchiness, and then irritation, generally about the females. Decreased vaginal secretion causes all that. Then, of course, lower sexual responses. Males, decreased size of the penis and testes, slower sexual response, shrinking of the penis and testes, and then BPH. All right. So, genitourinary increased fluid intake. Check for concentration of the urine. Yes, that's very true. That's especially even they have commonly also they have positive protein, 1+ protein when you want to check their concentration, protein concentration in their urine. Generally, as part of their changes, they have proteins in urine. All right, so how many minutes more left? Right. I think we can quickly go through the psychosocial development. It's also part of the changes, but it is something that we already know. So we can just quickly run through it. Basically, it is about between the ages of 40 to 65 we're talking about, because between 40 and 65 we would have what we call the midlife crisis, and so we have to hit generativity versus stagnation before coming into our ego integrity versus despair. I'm sure that we remember our 0 to 1, 1 to 3, 3 to 6. If there were time, we could have talked all about them, but there's no time, so let's just generally go through the generativity versus the stagnation period, where with generativity, there's a sense of productivity, care, and concern for others, right? Patient feels they have accomplished something, right? So the key features are developing relationship with family, making commitment to other people, mentoring others, contributing to the next generation. Major question that they ask is, how can I contribute to the world? Because I have gotten to a point where I am okay. I have achieved some of the things I want to, or most of the things. And so how best can I contribute to the world? And their basic virtue is care. At that point, they want to care, they want to give out. They want to give out. And so mostly the important event that happens within this stage is parenthood and work. Parenthood and then work. Mostly they are parenting. In some books they added on marriage, but now marriage is dicey. Some research are debunking marriage as part of generativity, as part of the achievement. They say it's not an achievement anymore. So basically it's about parenting and then work. So if we come to our local side, they will tell you that they ask of how many kids do you have. You don't ask of how many husbands or how many wives do you have. Right, and then we come to the stagnation, where a person becomes what? Unproductive, right? Or a person has things that he's unproductive and so has disconnected himself from others. So this is where there is failure to find a way to contribute. So some of these features are being self-centered, failing to get involved with others, not taking an interest in productivity, no effort to improve yourself or oneself, and then placing one's concerns above all else. So adulthood developmental tasks, what achieves goals of generativity. So they show concerns to the next generation. That's basically about how they feel or what they do within that stage when they have reached the generativity stage. Exhibit productivity, shift values from physical attractiveness, has more satisfying relationships. Learning activities and sexual interest is not declining at all. Of course, that time they are still on point. They can still do whatever they want to do, but still their basic interest of virtue is care. Accept and adjust to physiological changes, and then uses leisure time profitably. Then other, yes, of course, then the stagnation. Stagnation results from refusal to accept the changes brought by the aging process. So this is where there's an unresolved crisis. They have gotten to a place where, or a stage where they think that they are failures, because at this time, 40 to 65, let's say I've hit 50 years. 50 years, maybe I don't have kids. 50 years, I don't even have a proper job to do. 50 years, I haven't contributed anything to the society. And so they feel that they're a failure. And this is where they have this neurotic and psychosomatic disorder. Refusal to accept whatever, and they want to remedy it. They want to do something to remedy it. But that's at that point. But they say they can still remedy. Something can be done.
Hey,
Who say that even as at the age of 80, there's
hey.
the grown woman who said that she started painting at the age of 82 and then she excelled. She was successful. All right, so within this unresolved crisis, they are stagnant, they are bored, they are depressed, and they have decreased self-esteem. So for women, it is more of between 35 and 40. Within that age, if we think that we are not married, we haven't have kids, we haven't had a proper job, we think that we are failures. And for men, between 40, 45, some books are also saying 50 for men. So they also at that stage, they feel that now they can't achieve enough. So while at this age, for us, we still have time that we can do something for ourselves. So the midlife crisis, generally a period where there's that kind of emotional turmoil. We have to sit back and self-reflect, right? Yes, life begins at 40. That's great. Sit back and self-reflect. And then some people experience within that 40 to 60, others are saying 65 age, they feel they are triggered by aging and then major life changes. So the children leaving home, or children going to maybe secondary school, other places, so they're no more with them. Or there's a change in career. Mostly within that time after 40, sometimes you wouldn't be at the place where you were when you began your career. It's mostly there's that kind of shift. Then generally there's a normal stage. Yes, it's a normal stage in life, reevaluation of total life situation. Generally, it's a period of transition in life where someone struggles with their identity and self-confidence. That's generally about midlife crisis. So, have I achieved where I'm moving towards? Is it something that will be better than where I am or not? So, it's sort of a period where people will be thinking about the life changes they have done or they have made and whether it is the best for them or not. So last week, I think we talked also about the ego integrity versus despair, right? So a person's ability to look back on their life with a sense of accomplishment and fulfillment, right? When they feel that they are satisfied and then they have embraced their own actions and lifestyle. They have accepted who they are because they have looked back, they've said that they have done the best. And then despair, as we all know, there's bitterness, there is despair, right? Feeling that he or she has failed, that it's too late for a change. So they ponder over their mistakes, they feel depressed, they feel hopeless. So the changes, there's increased dependency. They become self-centered and they need tangible evidence of affection. Touching and companionship is very important for them. Their major fear: physical and economic dependency, chronic illness, loneliness, and sexuality, and aging. So life transition: grandparenting, reduced income, retirement, widowhood, awareness of mortality. Do you have any questions? Anything or any contribution? We're getting to the latter part we have run through. So any questions, any contribution? We have about 3 minutes more or 3 minutes left. Any questions, any contributions? All right. Is there no for all of us? Okay, so I'm sure some of us are still going to enjoy our Valentine, or we've ended it. I'm not sure we've ended it, right? So
Madam, Valentine don't finish.
Oh, no. So some of us are still going to continue. So let me leave you to have a wonderful evening, wonderful weekend. You'll meet next weekend. Thank you very much, and bye-bye.
Bye.
Bye.
Bye. I know my sister Patricia Oka is still going to enjoy the Valentine.
Au revoir.
Why do you like disturbing like that? Hey, I don't go. Be careful. You don't even know the one talking. Keep quiet. Hey, Salamatu, Tamale, be careful.
You will not on your mic and answer or ask question. You are...
When class is over, then you will not be making noise. Yeah, that time my mouth is closed.
So close it now.
Impossible. Aunt Abby,